G'day registrars, Marita Jones from Health Train back with you today. Today we're continuing our discussion about key features and how to identify them. If you haven't already seen the first blog, it would be a good idea to check that out because we're building on that material today. We were discussing the case of a 57-year-old man who presented with the signs and symptoms consistent with an inguinal hernia. We're going to use that same case today and then explore the principles of random case analysis to change small details in the case and see how that impacts on our clinical reasoning. Hopefully by the end of the exercise, you'll be comfortable to go and find cases of your own, pull out the key features, have a fiddle around with them and see how that impacts on things. The best way to do it, I thought, would be just to play a game. I'll put slides up on the screen and you can write down your versions of answers on a piece of paper and then we'll compare them. In this first slide, you should be seeing the case summary or vignette of the 57-year-old man presenting with lower tummy pain. We use lower tummy pain rather than lower abdominal pain or anything more specific because in a KFP we try and use patient language rather than using medical terminology. Now write down the key features as you see them. You can pause the slide if you need to for more time and consider all the types of key features. Demographics, that includes age, cultural background, gender, job. Think about presenting complaint, additional information, past history, examination, images. This second slide should show you a list of the key features that I identified in the case. Have a read through it and see if there was anything that you missed. Once you have a list of key features like this, you can synthesize the information into a medical summary in your own mind, which I've done on this next slide. That really helps me to make it clearer, to pull out all the useful information and then use that to test my list of differential diagnoses. If you miss a particular key feature, you can see how it would make you view the case in a completely different light. Now we've got a 57-year-old man with lower abdominal pain for several weeks, brought on by arduous physical activity, exacerbated by lifting, bending, relieved by lying flat. He's had one episode of severe pain associated with nausea and a hard lump near the groin, and he's otherwise well, but he has heavy alcohol intake and some financial strain. Now it seems pretty clear to me. Okay, let's change a few facts of the case and see what happens. We'll consider what's different. What if we just change the location of the pain and a bit of story about the pain? Take a look at the vignette on this slide. Now here's the list of the key features that I identified. Did you miss anything on this list? Let's consider a few different questions based on our new list of key features. Is there anything in here that changes your differential diagnosis? What do you think of the medication intake with ibuprofen and paracetamol? What about his alcohol intake or his stress? They might, if you've noticed them, change your mind a little bit for an abdominal pathology like gallbladder, more towards that of peptic ulcer disease, particularly with the ibuprofen intake, even though both of them belong on the list of differentials. The next things to start thinking are, how would you manage this patient? You're going to manage him quite differently to the first man that presented, but what would you do? And then, once you've thought about that kind of management, what kind of follow-up might be required? These sorts of questions are really helpful for you when you think about them in your practice. They're just the sorts of questions that might come up in the KFP exam. I'm going to try the exercise one more time. With this vignette, let's leave the pain in the lower tummy, but let's change the age and the gender of the patient. Take a look and write down your key features. Now you can have a look at the list of key features that I identified. It obviously comes up quite differently, at least starting with the gender and the age. She's got a different past medical history. She's got the same job. There are some similar differentials on the list, but the first things that come up on my differential list based on that are to do with pregnancy and pregnancy complications, particularly with the mention of no regular contraception mentioned and the lack of a regular period date. Those are really important clues that you shouldn't miss. So we might need to ask more questions on history to get the data we need there, or maybe you need to consider this in your next steps with management with different investigations. You might just be doing a bedside pregnancy test. So we consider the lower abdominal pathology as well, like hernias, appendicitis, renal tract infections, ovarian pathology. Changing the gender really changes our differential list. These are just a few minor examples of how you can pull important features out of a case, and then how if one of those changes, it completely changes the way you approach that patient. This is a good test of your clinical reasoning, and my challenge to you now is to go out and pick cases from your own practice and do this same activity. Do it again and again until you feel comfortable that you're identifying key features and you know how it impacts on your clinical reasoning. So I think good luck and have fun.